welcome back to Healthy Facts at UBC TV. My name is Caleb K. Today we're going to be looking at yellow fever. It's an interesting topic that you shouldn't miss out. I'm always profoundly honored and humbled for you always keep your eyes tuned on UBC TV. Well, what is yellow fever? Yellow fever is a viral infection that is spread by through a bite from an infected mosquito coming from an AIDS species. This virus that causes yellow fever seems, according to scientists, that it belongs to the filariae species of virus. Well, looking at the statistics of yellow fever, well, someone can say it's not a common disease, but this disease is common in South America and Africa. Statistics say that over 200,000 cases are recorded in South America and Africa, and of which 90% of the 200,000 cases recorded are recorded in Africa. Well, yellow fever has been rampant in a country like Senegal, whereby about 53,000 cases have been recorded out of the 100,000 samples that have been, taken. And followed by Ghana, where it's all about 1,300 cases out of 100,000 people. Well, can I say we've been lucky, or a little bit lucky or unlucky in Uganda, where it's all about 9 to 13 cases out of 100,000 samples taken. Well, yellow fever is such an interesting condition that sometimes goes unnoticed or misdiagnosed because it resembles some other infections like typhoid, malaria, and sometimes it presents like the known hemorrhagic fevers we know, like Ebola. What are the signs and symptoms of yellow fever? Well, it presents like other fevers where someone has that severe, sometimes non-projectile vomiting, yes, that abdominal discomfort, generalized abdominal discomfort, that vomiting, the diarrheas, generalized body weakness, loss of appetite. But the core, or the most important clinical feature, is the bleeding from the openings of the body, and that is the nose, the mouth, and the ears. Well, yellow fever, when someone sees those symptoms or someone sees those clinical features, someone can't fail to diagnose yellow fever. However, in Africa, there has been a problem in diagnosing yellow fever because we lack the capacity in our laboratories to be able to diagnose yellow fever based on laboratory investigation. How is yellow fever spread? Like I said before, that yellow fever is spread by when a person when a person gets a bite from an infected mosquito. Yeah, when a person gets a bite from an infected mosquito carrying the virus. When something is infected, it means it is carrying a causative agent, and in this case, it is the virus we say that belongs to the filariae virus. What is the mode of transmission of yellow fever? According to researchers, they say that yellow fever is transmitted, or the mode of transmission is in 3 ways. The first one, there's what we call the jungle yellow fever. Well, jungle yellow fever looks to be interesting because this is English. Jungle, for those who are so familiar with the environment, may be meaning something like forests. Well, according to researchers and scientists, they say that when the monkeys who are living in the rainforests are bitten, by infected mosquitoes, mark my point. When the monkeys living in the rainforests are bitten by the infected mosquitoes or the infected AIDS mosquito, and later on when the humans visit such forests where the monkeys that have been bitten by the AIDS mosquitoes are living, and then later on the mosquitoes as well bite, the monkeys and suck out the virus and then bite the humans. In that way, there is a transmission of the virus. So this is called the jungle mode of transmission. So it starts with the monkeys being bitten by the mosquitoes that carry the virus. At the same time, the mosquitoes bite the monkeys and then pull out the virus, and it is injected into the bodies of the people who have visited this forest. However, according to researchers, they also say that the mosquitoes that are not carrying the virus, or the mosquitoes that are not infected, they also get, the virus from the human beings that have been infected with the virus. That is called the jungle mode of transmission. However, we have some other modes of transmission, like we have the intermediate transmission and we have the urban transmission. Let me just throw some little light about the urban way of transmission. This occurs when the human beings who visited the forest now happen to go back to their home areas, and in the so doing, uninfected mosquitoes, the mosquitoes that don't carry the virus, come into contact with these people who are coming from the forest, and in the end, they pick out the virus from such human beings, and then they are spread to the people living in the urban centers. Well, someone may ask a question that can yellow fever be treated? Well, like we say, that yellow fever presents with signs and symptoms such as vomiting, abdominal discomfort, diarrhea, then bleeding, dehydration. According to research, scientists have not yet come out with the genuine medication for yellow fever. However, when a patient presents at the health facility with the signs and symptoms of yellow fever, what your doctor or what a health worker will do will treat, the symptoms in order for a patient to get some relief. For example, if the patient presents with a dehydration, of course, your clinician or your doctor will have to, rehydrate the patient. Will look for ways of how we'll stop the diarrheas. This yellow fever sometimes, occur in conjunction with other bacterial infections. So the bacterial infections will be treated with antibiotics. So it's all about treating the symptoms as we make the patient comfortable. But according to research, as per now, there is no medication that has come out genuinely or specifically designed for yellow fever. Someone can ask a question that if it's such a deadly disease, how can we prevent yellow fever? The prevention of yellow fever is in three forms. One, I normally tell people that it starts with us. It starts with us, and then with the community. So now when a child is born, it is a parent's responsibility to make sure that his or her child doesn't become infected with yellow fever. How can the parents do that? One, through vaccination. Vaccines have been put out by the government, and they are safe and they are more effective. So if given out to people, they can try to build their immunity against yellow fever. So one way on how we can prevent yellow fever is through vaccination. Then the other thing is how to get rid of the mosquitoes. We've all been bombarded with these theories from primary, secondary, and some of you are still studying them at university. How can we get rid of the mosquitoes? One, we used to say that drain away stagnant water around home. Yeah? Drain away stagnant water around home. Dispose of, empty baskets, empty tins. They tend to act as breeding places for mosquitoes. So if these things are in place, if the stagnant water is not drained away, it is going to act as a breeding place where these mosquitoes are going to lay their eggs and multiply into many numbers. So if you can, drain away the stagnant water, discard of, the unused tins, then in that way, you're trying to get rid of the mosquitoes, and in the end of the day, you will not be infected with yellow fever. There are so many ways in which we can get rid of the mosquitoes. That is one of them. Secondly, you can, for those who are staying around the bushes, when the bushes have taken up your compound, don't wait for them to grow so long. Please, you can trim them, or you can cut them, you can slash them, because when you leave them, they will act as habitants. This is where the mosquitoes will hide during the day, perhaps even in the night, and then later on in the night come and terrorize you. So when you get rid of these long, do we say long or tall? Okay, the tall bushes, when we get rid of them, then we are trying to get rid of the habitants of these mosquitoes. Then there's this most important point that the government has emphasized, and that is if you, your children, and the people around you sleep under a treated mosquito net. I repeat, a treated mosquito net. Every net can be slept in, but if your net is treated, that means that even a mere contact of a mosquito before it penetrates into your net, it's dead already. So if we can do those, if we can sleep on the treated mosquito net, slash away the bushes, drain away the stagnant water, in so doing, we are trying to prevent the spread of yellow fever, because we said earlier on that this virus that causes yellow fever is transmitted by the Aedes mosquito. Okay, so the other thing someone can ask himself, that what is another preventive measure? This one, like I said before, that it starts with us. It is personal. It's all about you. So when you like fashion and you decide to put on, the short skirts, you like putting on, the shorts, that means that you're exposing your body, for the mosquitoes to bite you. So if you are in a yellow fever belt, or if you are in these areas that have a high concentration of mosquitoes, so I would say, please put on shirts with long sleeves, blouses with long sleeves, and put on long skirts, and put on long trousers, such that your body stays covered, and in so doing, your body will not come into contact with the mosquitoes, and at the end of the day, you will not be able to contract yellow fever. Like I said earlier on, that how can we prevent yellow fever? And we said that the first way is through vaccination. And there comes a question: do you think that everyone is worth to be vaccinated against yellow fever? Well, before we see who is not supposed to get the vaccine, let me take you through who is supposed to get the vaccine. According to scientists, they say that people who are living in the yellow fever belt, or the people who are living in regions that are having a high concentration of these Aedes mosquito, like I said, these people who are living in the tropical rainforests, it is up to you to get this jab against yellow fever. And then the other thing is the people who are working in the laboratories, or the laboratory technicians, because they come into contact with many samples. So it is much more advised for them to get the vaccine against yellow fever. And then scientists also believe that for children who are above 9 months, it is responsible for you to get a jab or a vaccine against yellow fever. Who is not supposed to get this vaccine? One, scientists say that for children who are below 6 months, in bold, I say, for children who are below 6 months are not supposed to get the yellow fever vaccine. And then pregnant mothers, those who are expecting, or those who are carrying a fetus in their bellies, they are not supposed to get this vaccine unless they are living in an area that has been a catchment area for yellow fever. So otherwise, every person is supposed to get the vaccine. Every person is supposed to get the vaccine against yellow fever, unless the people I've talked about in the above. what is the role of the community and the leaders we have, and how have they helped us to curb down yellow fever, especially in our country? One, the leaders and the community leaders, the religious leaders, perhaps the health workers and the government, they must do a role of emphasizing about yellow fever, because this is a disease that many times has gone unnoticed. And we've seen our clients suffer from it. Remember, we say that in Uganda, it's about 9 to 13 cases out of 100,000 people. We don't want to take chances. Even one life matters. So we need to teach people about yellow fever, that if anyone presents with one or two symptoms like we talked about, it's a guarantee for these people to rush very fast, such that they can get medical attention before the disease exacerbates. And then the other thing is we should emphasize people the benefits of vaccination. Yeah, I've been in villages, I've been in towns where mothers do not want their children to be immunized in the name of saying that these are European drugs. They are trying to introduce microchips into our bodies such that we can be tracked down anytime they want. But I want to say that if you get the vaccine, if you get these jabs, you create immunity. Your body becomes strong enough that in case this yellow fever, or in case there is an outbreak of this disease in your community or in a country, your body will be strong enough to fight off this disease. Who is at risk of getting yellow fever? Like I said before, the people who are at risk of getting yellow fever are those people who are not immunized against yellow fever. Like I said, I emphasize this point that for us to stay safe, for us to, to stay safe and not to be among the 9 to 13 people out of the 100,000 people, not to be infected with yellow fever, we really need to get the jab, or we really need to be vaccinated against yellow fever. Then the other people who are at risk of getting yellow fever are these people who are getting a livelihood, or people who are working, in forests. Okay, they can be the tourists who go on in forests for procreation, not procreation as such, but to explore the environment, to look at the natural endowment that Africa has been benefited from since creation. The other thing is the people who are at risk of getting yellow fever are these people who are working in laboratories. Like I emphasized before, that it is very much important for people who are working in laboratories to get the yellow fever vaccine. The other thing is someone sent me a message here and was asking me a question that is yellow fever yellow? Does yellow fever present with yellowing of the body? Maybe let me make this a little bit clear. Yellow fever got its name due to from the way it presented. If you guys have been here from the old times, where our judges used to tell us about omusujja gwenkaka. So the omusujja gwenkaka is actually the yellow fever we are talking about today. Yellow fever got its name from the fact that due to the continuous yellowing of the eyes. If you try to look at a picture, or if you try looking at a person who has contracted the disease of yellow fever, you realize that the eyes are always yellow. And therefore, the name yellow fever got its name from the way it presented from the start. Well, yellow fever, however, has been a disease that many of us have left hanging because we've not read more literature about it. We've left information hanging. We've not made enough research about yellow fever. Like I said, that the clinical features of yellow fever, we have that intermittent high-grade fever. The fevers that come and go within the first 3 to 6 days, and later on stays for a long period of time in the next few weeks. And then we say that there's this continuous bleeding from the openings of the body, and that is the mouth, the nose, the ears. And then we say that a person with yellow fever presents with this abdominal discomfort, okay? And then this person gets the unstopping or unresolving passing out of loose watery stool. Like I said before, during the treatment of yellow fever, the government and the Ministry of Health have not come out with yet the exact medication that can help us treat yellow fever. But however, according to guidelines, the principles, the measures that have been set, or the measures that have been put in place on how we can manage a patient presenting with yellow fever. And in one of them is, if a patient is presenting with the high-grade fever, this patient is given a medication that can help a person to calm down the skyrocketing temperatures. And then the other thing is, if a patient is presenting with a dehydration, a person is put on IV fluids in order to balance the fluids. And at sometimes when the person is losing a lot of water stool, at that point, that person is losing a lot of electrolytes. So in one way or the other, fluids help in electrolyte balance. And then sometimes they present with generalized body weakness, they present with that inability to eat. So nutrition here, feeding, is a key point that is always emphasized during the treatment of yellow fever. Like I said before, that some of the symptoms or some of signs present with bacterial infection. So we can use antibiotics such as metronidazole. Just we all know that metronidazole is so good with the GIT conditions, because we say that the patient presents with that abdominal discomfort. So if we give this patient a metronidazole, IV ceftriaxone, in one way or the other, we are trying to cut down or try to reduce the severity of the disease. However, continuous efforts are still needed from personal, community, and the country as a whole. If we come together as a team, I believe we can cut down the yellow fever that is at a rise, 90% in Africa. Thank you so much for tuning in. See you the next program. Bye.